morning all, welcome to my channel Medicine with Shiji. This channel is mainly intended for MBBS students who are interested in clinical medicine, and I'll be giving you tips in symptom analysis involving the various major systems in the internal medicine. So symptom analysis is really important for a proper history, and that will help you to reach at a important clinical diagnosis. So welcome to my new channel, and let us go to the sessions. So good morning. So today we'll be dealing with the symptom analysis of cardiovascular system. And you all know the cardinal symptoms of cardiovascular system involvement involves chest pain, breathlessness, palpitation, syncope and edema. These are the 5 cardinal symptoms which might suggest a cardiovascular system involvement. And among them, chest pain is the most common and the most important. So let us see how we can analyze the history of chest pain. So since chest pain is might be an indication of a serious cardiovascular disease, and since most of the patients are very much aware of that, whenever a patient gets a chest pain, they come to the doctor immediately, and it is for the treating doctor to distinguish between the serious and the less serious cause of chest pain. So these are the most common cause of chest pain, starting from the least serious cause like musculoskeletal pain, then comes the neuralgic pain, esophageal spasm, pleuritic pain, and the more serious cardiac causes, that is angina, pericarditis as well as aortic dissection. So coming to musculoskeletal pain, it is one of the most common causes of chest pain, and usually it follows a heavy exercise. And on the previous day, the patient might give a history of heavy weight lifting or heavy unaccustomed exercise, and it is a dull aching pain that is felt all over the chest. And the thing is that, like angina, it is not precipitated by exertion or relieved by rest. It is present always. And actually the thing that worsens such type of chest pain is movement. Moving to sides etc. will worsen the pain. And in this comes another entity known as costochondritis, which is more common in females, where the patient will have diffuse tenderness of the chest and also pain on movements. So that is regarding musculoskeletal pain. Now, neuralgic pain is another important cause for chest pain. It is very difficult to identify the neuralgic pain in the first visit. It typically follows a distribution along the affected dermatome, or it occurs in a band-like pattern actually. And it may be perceived as pain, but it can also be perceived as sensation of tightness, stabbing or aching pain. And there may be associated paresthesia, numbness or tingling involving the specific dermatome. That the pain is confined to a specific dermatome is the one that helps us to distinguish neuralgic pain from other cause of chest pain. And usually it is seen in conditions like post-herpetic neuralgia or just before the onset of herpetic vesicles, etc. And maybe as a part of trauma, also you can get a neuralgic type of chest pain. Now, pleuritic pain is another significant cause of chest pain. You know, in the lungs, it is the parietal pleura that is sensitive to pain. And whenever the parietal pleura is inflamed, what happens is that during a deep breath, the visceral and the parietal pleura, when they rub to each other, the patient gets severe pain. So it's a localized sharp pain, and the patient usually gives a history that they have to catch the breath during the depth of inspiration. That is one thing that helps us in the history to differentiate a pleuritic pain from other causes of chest pain. And also it does not have much relation to exertion, or there may not be associated sympathetic symptoms, and there is no radiation of pain. And this pleuritic pain may be preceded by fever, sore throat, etc. Now, esophageal spasm is a rare cause of chest pain, but it is important because it actually mimics an angina. It is retrosternal, it is central, and even though there is not much of a relation to exertion and more relation to food intake, it may be associated with sweating, and it can be relieved by nitrate. So it is difficult to distinguish such causes of chest pain from the more severe cardiovascular cause. Now coming to angina, which is a serious cause of chest pain. Here the patient will usually complain of a feeling of heaviness, but rarely there can be other symptoms like dull aching pain, etc. It is central or retrosternal. And usually they can have a radiation, even though the classical site of radiation is to the inner aspect of the arm, left arm, it can be to the inner aspect of either arms, to the jaw, or anywhere above the umbilicus. And there may be associated sympathetic symptoms like palpitation and sweating. And classical angina is usually precipitated by exertion and relieved by rest, but unstable angina can occur, which is similar pain, but it can occur even at rest. Or any unstable angina which has increasing frequency and duration is also classified as unstable angina. So whenever a patient gets an anginal pain, you can classify or grade the pain according to Canadian Cardiovascular Society grading of angina, in which the class 1 pain is the patient is asymptomatic during usual routine activities. Only heavy exertion brings the pain. Class 2 is slight limitation and symptoms during vigorous heavy exercise. While class 3, there is moderate limitation symptoms during everyday. That is, the patient is not able to do everyday living activity, they get the pain. And class 4 means pain during any activity. They cannot move at all. There is severe limitation of activity. So, this might, when you say the chest pain, according to the Canadian Cardiovascular Society grading, you can classify it according to the severity of symptoms. And so, the listener might get an idea as to the severity of chest pain according to this grading. Now, myocardial infarction also is another important cause for chest pain. The pain as such is similar to angina. The only thing is that anginal pain lasts for about 5 to 10 minutes, while myocardial infarction already the myocardium is necrosed. So, even after you take rest, or the symptoms will not disappear, and it will last for more than 30 minutes. Usually, association is the duration is more than 30 minutes. It may be associated with severe palpitation, sweating. There may be a feeling of impending death, etc. in myocardial pain. Rarely the patient can have myocardial pain can be associated with nausea, vomiting, etc., especially in inferior wall myocardial infarctions. And there may be autonomic stimulation may produce diarrhea, etc. So these may all be symptoms of a myocardial infarction. Now, there is another important cause of chest pain, that is pericarditis. Actually, pericardial pain should be differentiated from an MI, because after an acute myocardial infection during the second or third day, when a patient complains of chest pain, we should be able to differentiate between pericarditis that is causing the pain as well as post-infarction angina, because treatment is slightly different in both. Like in pericardial pain, it is a localized retrosternal pricking pain, and it does not have radiation like an anginal pain or a myocardial infarction pain. There may be associated pleuritic pain because of the associated inflammation of the pleura also. Sometimes the patient might prefer certain positions like sitting up and leaning forward position. So that should be differentiated from an anginal pain. Again, another most severe cause of chest pain is the aortic dissection, which is a very serious and severe cause of chest pain. Here the pain is maximum at the onset. It does not build up like an anginal pain or a myocardial infarction. There is a sudden tearing pain at the onset, and it radiates from the anterior chest to the interscapular region or to the shoulder blades. There may be associated palpitation, and on examination sometimes you can get an asymmetry of pulses. And the treatment is, once you identify an aortic dissection, there are many investigation modalities to confirm your diagnosis, and the treatment is also different from a myocardial infarction. So these are the different causes of chest pain, starting from the least serious to the more serious cause of chest pain. And history might help us in to differentiate all of these and in planning the investigations. Thank you.